aspirin, a hidden anti-cancer potential? Studies suggest it may help reduce the risk and slow the progression of certain cancers, including colorectal cancer, breast cancer, and even multiple myeloma. However, its role in cancer treatment is still under investigation. Mechanisms of aspirin's anti-cancer effects. 1. Inhibition of COX-1 and COX-2, anti-inflammatory action. Aspirin inhibits cyclooxygenase, COX-1 and COX-2 enzymes, reducing the production of pro-inflammatory prostaglandins. Chronic inflammation is linked to tumor growth, and by lowering inflammation, aspirin may suppress cancer progression. 2. Reduction of platelet aggregation, antimetastatic effect. Tumor cells often interact with platelets to evade the immune system and spread through the bloodstream. Aspirin prevents platelets from shielding cancer cells, making them more vulnerable to immune attacks and reducing metastasis. 3. Induction of apoptosis, cell death. Aspirin has been shown to trigger apoptosis, programmed cell death, in cancer cells by affecting pathways like BCL2, p53, and caspases. 4. Inhibition of WNT-catenin signaling, cancer stem cell suppression. This pathway is involved in tumor initiation and resistance to therapy. Aspirin may inhibit WNT-catenin signaling, reducing cancer stem cell survival. 5. Reduction of DNA damage and mutations. Chronic inflammation can cause oxidative stress and DNA mutation. Aspirin lowers inflammation, potentially reducing DNA damage and cancer risk. 6. Antiangiogenic effects, blocking tumor blood supply. Tumors need new blood vessels, angiogenesis, to grow. Aspirin may inhibit vascular endothelial growth factor, VEGF, limiting tumor blood supply. Conclusion. Aspirin shows promise in cancer prevention and treatment, mainly by reducing inflammation, inhibiting metastasis, promoting apoptosis, and preventing angiogenesis. However, its clinical use in cancer therapy is still under investigation, and it should not replace standard treatments.